Thanks very much, Dr. Rohack, and thanks to everyone. And I'm just thrilled with the attendance for an afternoon session. I'll be as quick as I can because I recognize that I and the other speakers are between you and home. I got invited to talk about quality, going the EMR route. Just as a little bit of a disclosure, I work for the Baylor Healthcare System where I'm a computer doctor, and I work for UT Southwestern where I'm a baby doctor. And I want to cover very briefly 5 things today. Just first, I just want to point out quality and EMRs are not synonymous. There's a lot of people out there that will lead you to think otherwise, but it's not true. I want to talk a little bit about key points in selection and your preparation for an electronic medical record. We can, some points on TMA tools and resources, something about what's called regional extension centers, and these are organizations that are designed to provide help to physicians. And then finally, a few words about health information exchange, which is kind of the new EMR. And I have to give you some background on that because that's up and coming and you need to know about it. So back in 2005, I first became interested in the subject of do EMRs and quality have anything to do with each other? And so I did a Medline search from 1975 to 2004, and I found out of about 232,000 articles, only 218 overlapped. And really, the quality people were talking about one thing, and the EMR folks were talking about another thing. And they really never ever thought that they had anything to do with each other. And of course there was some talk about it, but very little literature. But in fact we know EMRs do improve quality, okay, if quality is defined as legibility and readability. And they also can improve quality by helping us to remember our guidelines. As Dr. Fullerton said, you can really improve the quality of what you're doing by using EMR as part of your brain to help you remember things. So a few words really about EMRs. Right now there are 261 ambulatory EMRs out there, and if you wandered around the exhibit hall, there's all sorts of vendors popping up that I have never, ever, ever in my life heard of. The most important thing that you can do is really the preparation work, preparation in terms of understanding the workflow in your practice and making sure that the EMR and your workflow really work as a partnership. It may be that your workflow has to change to fit the EMR. That almost certainly happens. But the EMR also has to fit your workflow. And I'll give you an example. It's a pediatric one because that's who I am. But we get a lot of moms come in with 2 children. You take care of the one child, and as you're just ready to walk out the door, mom goes, "Oh, by the way," and the other child has a problem. Well, if your EMR requires you to go out, register that child, get everything, go through the whole process and whatever, you've just crippled your workflow for, quite a bit of time. There are EMRs that are more pediatric friendly that will give you a much better flow where you can basically call up the other child's record, do a quick registration, enter the information, and in fact, if there's family and social history that you want to transfer, you can automatically transfer it from the one child to the other. That's really workflow support, but not all EMRs do that. And whatever your specialty is, you really need to dig into understanding what your workflow is and then understanding what the EMR can do. And it sounds like my mic is kind of going in and out. Am I all right? Okay. All right. The other important thing is you really have to analyze all the steps of this workflow. And there's lots and lots of examples where people have selected an EMR and they didn't dig into a particular workflow because the person who was helping them with the selection, be it their office manager or whatever, said, "Oh, don't worry, it'll do that." And in fact, it doesn't. Small practices, interestingly, sometimes can recover pretty quickly because it's a small practice. Larger practices really can get crippled by this sort of failure to really analyze every step of the way. And so it takes time to do this. It's both your staff, and if you're a physician, it takes your time. And really, truly, you should get help. I had the word probably here and cut it out 5 minutes ago. You should get help. So I've been talking about EMRs for about 10 years now, and one of the things that I want to point, that I've always pointed out, is that EMRs are not the panacea. And there's a lot of stuff out there that can really cause you problems. And this is the latest data that we have in 2009 of how physicians are reacting to EMRs, or how physicians are handling EMRs in the state of Texas. And about 50%, sorry for the black on blue there, about 50% are reporting that they are difficult, awkward, or time-consuming. That gets down to the workflow issue. If you set up your EMR, if your practice is such that it works well with templates, spend a lot of time working up your templates so that you can go through it quickly and gain time on the things that are templatable. You will lose time on the things that are not. But if you really work at it, on balance, you can be okay. But if you don't spend the upfront time, it's just like everything else in life. Don't spend the upfront time, you'll suffer. Caution, new types of errors are possible. On paper charts, we have all sorts of clues that keep us from doing certain things. Just as an example, if you have a patient who's been in your practice for a long time, that's going to be a thicker chart. In pediatrics, we use blue and pink to differentiate boys and girls, and in the electronic world, they all look the same. And so when I started using electronic medical records, I can tell you I charted on more wrong charts in the first 2 years before I got used to this concept that every record looks the same. So watch out. There's all sorts of ways that you can you can have problems with your records. So there's quite a number of things. I just want to move through, reiterate, EMR must support your workflow. There's a couple of places where you can get support. Most importantly, the TMA has a technology support page. There's an EMR implementation guide on this, and there's an EMR comparison tool as well, and we've got some contracting language that will be going up shortly. In that comparison tool, we've taken 8 of the largest 10 EMRs in the state of Texas, and we've actually dug into the details of pricing, of features, and it really can help you quite a bit, certainly if you're talking to these vendors, but also if you're talking, it gives you guidance when you're talking to other vendors. Other EMR support, CMS has something, but most importantly, if you have a specialty society, look at that. I'm from pediatrics, so ours is, it's an open site, by the way. Anybody can go to it, aapcokit.org/EMR. And we have rankings on a scale of 1 to 5. We've got a number of 4s, or 4s or above, a bunch of 3s, and sadly a bunch of 2s, where pediatricians have rated their EMRs. This is going to be your absolute best friend, Texas Regional Extension Centers, TXREX.org, North, Centreast, Gulf, and West Texas. They've got about 25% of their number of physicians signed up. Really work with them. TMF, I know, is working, Earl's in the back, they're working with several of these, if not all of them. When you click on that, you'll get this page, a little busy, but look for your particular geographic area, and you can get there. One last thing, health information exchange. You're going to be asked to hook up your practice, your EMR, to a health information exchange. Health information exchanges are going to be paid from the government by each physician that they get. So you're going to be getting something that says, sign up now, please. The important thing is that you understand that same concept, you're buying access to a system. So you want to make sure that this exchange will actually do what you need to do. And be alerted, there's a thing called the continuity of care record or the continuity of care document. And basically what it is, this is one displayed here, it's going to be how we exchange information. And in a nutshell, right now, if you send out a piece of if I sent a web page out and it had my name on it, then a receiving computer would have no way of knowing that my name, that SCHNEIDER, that's a last name. The beauty of the continuity of care record and the continuity of care document is it has special tags that lets the receiving computer know that this is a last name, or this is a medication, or this is an allergy, and it sticks those things into where your computer will want it. So with that, I wanted to stop. It's a brief overview. It's not, the EMRs are, electronic tools are crucially important in the quality journey. But be very careful as to what you get, because in fact you can fall into a swamp. TMA and the regional extension centers are out there to help you, and with that I will stop. Thank you very much.